Hi there, I'm Dr. Chung, and welcome to your friendly proctologist. Thanks so much for being here. I wanted to make a video devoted specifically to diet around the surgery recovery time, and I hope you get something out of this. Now, many people would say the recovery and the diet should begin before the surgery date, and that is awesome if you think that way, because you're kind of gaming your mind, trying to figure out strategies to make your life easier. In general, I will tell you that it doesn't make any difference, okay? Some doctors will tell patients to actually drink like a Miralax prep, make them poop all their diarrhea out, like a colonoscopy, so they're completely emptied. And other doctors like myself, we don't do that. Maybe I'll have you do an enema just to clean out what's in your rectum so I can see what I'm doing better and I don't have poop all in my face. But other than that, I don't have you do that. In my opinion, the whole process of emptying out your intestines, even doing like a bowel cleanse, some people may think that's a good idea. In my opinion, that is not a good idea. You should keep your system as normal as possible and it will reset. I've got strategies to help you with that, especially if you're having surgery with me. In general though, again, do your normal thing is my suggestion. What's your normal diet? The stuff you normally eat in the amounts that you normally eat. Okay? However, if you want to have a celebratory meal or say like, this is the last chance I have to eat before maybe 2 weeks, if I have a normal, regular thing that I normally do, then go ahead and do that. I don't think it really makes a difference. I don't see a difference between people who fast and versus people who just do their normal thing in terms of when the bowel movement comes or whether it's soft or not, okay? I see it as, in my opinion, all the same based on the patients that I track very closely. What about after the surgery, okay? You get home from surgery, you starved yourself for by this point, maybe 10 hours, and you say, oh my God, I'm thirsty. Oh my God, I'm hungry. I want to scarf down a Thanksgiving meal or a Christmas meal right here, right now. I will tell you, please don't do that. Please don't. Why? The big thing is what's called an ileus, okay? These medications that the anesthesiologists give you to go to sleep, the pain pills that I give you, even in the recovery room, all the injections of pain medications, etc., slow your intestines down. It's like the brakes have been put down and everything is just coming to a screeching halt, okay? And that's a normal side effect and it happens to everybody. So when you have your first meal or your first drink, okay, please keep it small. I tell people snack more frequently, leave yourself hungry a little bit after you finish your snack, okay? So the reason is because if your train of poop is halted, it's like a pretty long train stop, and you keep loading stuff from in your mouth up above, there's nothing coming out the end of the tunnel here at your anus. Guess what? It's going to keep backing up. Your belly's going to get big and bloated. You're going to feel bloated. You're going to feel full. And you're also going to feel nauseous. You may feel like you're going to throw up, and you may even throw up, okay? You're going to look down and say, oh my God, I didn't even eat that much, but I look and feel awful, okay? The anesthesia medications that they give you, sometimes even the pain medication side effects can give you nausea. And if you have that in addition to the intestines being backed up, it's just not very ideal here, okay? So small sips, a little bit of time, you're not going to die of dehydration. And then small snacks, okay? Let's think of it that way. Small snacks, 4 to 6 times a day instead of 3 big meals like you customarily may do. All right, what kinds of foods should you have? Many doctors, or you may see on the internet, will say, start that high fiber gear way up and keep it going again. We just did hemorrhoid surgery. You want to keep your hemorrhoids in good shape, blah, 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 blah. I will say that is wrong, okay? And I think that is counterintuitive and actually potentially harmful to your recovery. Why? Fiber bulks up your poop, makes it wider caliber, and that even if it's completely soft, okay, you've got to still make this poop come out of your anus, okay? What is your anus doing during this recovery? Well, it wants to stay closed. For some people, it may even be spasm closed, which if it's doing that and you gotta push this big giant fiber poop out, do you think that's gonna be, do you kind of get my drift here? It's not gonna be fun. Now, it's normal to have to push harder than usual with your first poop, especially, and during your recovery, because, well, there's been wounds cut into your bottom end. You can bet that it's going to be an issue with that first poop. So, the strategy, in my opinion, less bulky stool, smaller caliber poop, very, very soft, even like frozen yogurt texture poop is the strategy here. Don't you think that makes sense? It's going to be easier to push out, it's going to be easier to change shape, and you don't have this giant, bulky cannonball sitting on top of your anus that you gotta push out until you pass out. Okay, not ideal at all. So what's the diet called in general that you can look up online? Low residue diet, or in other words, a no fiber diet, or low fiber diet, I should say. Low fiber makes your poops, you may poop a little bit more often. You may have more liquidy, frozen yogurt textured stools, but it's gonna be small, slim, and it's gonna be way more comfortable for you, okay? So I printed something off the internet. It's very easy to do here, but in general, can you have your breads and pastas? Check. Can you have your meat, fish, and poultry? Check. Can you have some fruit? Yeah, don't do the peels. Maybe some well-cooked fruit, okay? Like applesauce would be great. Cooked soft vegetables, they have examples here: carrots, cucumber, mushrooms, all right? And then you can have dairy too, but you want to limit that. And this says here, limit 2 cups per day. But when you're doing smaller meals, you're kind of moderating anyways, and so it's not really an issue here. Okay, is this diet permanent for the rest of your life? No, it's not. Probably for the first week or so until you get that first poop. That's when I would suggest following this diet, but you're slowly going to feel more comfortable. Your belly's not going to feel bloated. Your meals are going to start to get a little bigger because you're not so huge. Your belly doesn't look so big afterwards, and you're going to see like, oh, I'm just going to eat maybe a bag of chips here or something like that. And then start bringing in your old foods again after about a week, and you're going to start seeing you're going to get back to your normal schedule again. So definitely this is complete strategizing so that your life and your anus will thank you for it, and you can have less pain because stretching out your bottom end and having that poop scrape against the sides of your anus where the wounds are, that is what we're strategizing here. So ignore your doctors and your nurses or whoever the heck you're talking to. High fiber, wrong answer. How do I know? Because I've tested it on my patients every single time, okay? So do what works for you. Do what you feel is healthy. I wish you well and see you in the next one. Bye-bye.